I'm Dr. Nandita Palshetkar, Medical Director of Bloom IVF Center. And in my 25 years, I have seen a lot of patients come. They've been asking questions, what are the problems, what is infertility? And I think it's very, very important to explain to them. And today I've taken time off to actually talk about infertility, what are its causes, what actually is infertility, and what should the patients do. I think the investigations, etc., and information is really important for patients to take the right decision. I think that is a very relevant question. What is infertility? Infertility is when a couple gets married and it tries to have a baby. They try to have a baby and more than a year has passed and they've been unsuccessful. I think that is infertility. That is what the WHO also defines it as. The causes of infertility are multiple. You should divide them into male factor and female factor. This is something very important to communicate to the patients, that you must understand that the man and the woman both can be responsible for infertility, and that is why it's very important that the couple comes together and we examine both you and your husband. So if you look at the woman, what are the problems that can lead to infertility? One is a hormonal imbalance. The hormonal imbalance can be of the thyroid hormone, of the prolactin hormone, or even a simple thing called PCOS or PCOS or polycystic ovarian disease. This is a result of a hormonal imbalance, and because of this, what happens is, people get irregular periods, they can have, heavy periods also, and they don't ovulate. Prevention of infertility can be done in many ways. Let's look first at the lifestyle. The weight. The weight should be normal. You can't be overweight or underweight, because that brings about a lot of hormonal changes and brings about ovulatory dysfunction, menstrual problems, etc. The second thing is, I think, a good sleep. A woman needs 7 to 8 hours of sleep, and the lifestyle should be such where you're sleeping at a good time and waking up early, because the body needs to regenerate. The third thing is abuse of substances. Cigarette smoking is a no-no, man as well as woman. I think you must prevent it. The success rate of IUI is about 15 to 20% only. And I think it's very important to understand that treatment of infertility is a repeated treatment. You can't do one IUI and be disappointed, that I have patients who come and say, I've already done one IUI. But IUI needs to be done at least 2 to 3 times before you give up on it. When we talk about infertility, I think 1 year of trying is important. Age is very relevant. The younger you are, the better are the results. Infertility can be prevented. There are lots of factors: diet, exercise, infection prevention, unsafe abortions, then pollution aversion, then unsafe sexual practices. All these actually, no smoking, no drugs, no alcohol, all these factors can help you prevent infertility. And if you are infertile, I think you must go and get it diagnosed. It's very important, because early diagnosis, early treatment, and the success rates are very good. Two pink lines, that is what will give you happiness in your life. And I think if you don't get them, don't be disheartened. Go to the doctor, get treated, get diagnosed, and I'm sure you will be happy with those two pink lines when they enter your life.